Hello, everyone. Welcome to Health Professional Radio. I'm your host for today, Tabetha Moreto. Our guest today is Dr. Bill Harris, an expert on omega-3 fatty acids and how they can benefit patients with heart disease. Today, we're going to talk about something very interesting, the launching of a self-administered omega-3 test called Omegaquant. Without further ado, welcome to the show, Bill. It's very nice to have you here.
Oh, well, thank you very much for having me.
My pleasure. Bill, please tell the audience more about yourself and the nature of your work.
Yeah, my area of expertise is nutrition, and I've been studying omega-3 fatty acids, and I've been on the faculty of 3 medical schools in my career. Currently I live in South Dakota in northern United States, and I'm continuing to work with the omega-3 field, having developed about 13 years ago the blood test that you mentioned, Tabetha, as we got started.
Excellent. So tell the audience more about this omega-3 test. What makes it so special?
The omega-3 test, we call it the omega-3 index, and it's done from a dried blood spot, a single spot of blood collected on a filter paper and then mailed to the laboratory. What it it gives you an assessment of the amount of omega-3, EPA, and DHA that are in the person's tissues. We know that what's in the blood reflects very strongly what's in the vast majority of organs in the body, the liver, the heart, etc. So we use the omega-3 level in the blood as a marker of omega-3 status throughout the body. The assay has been used, or the test has been used in many studies at this point, and it's become more and more standard for measuring omega-3 status.
That's good to know that there's a test out there that lets people know what is their omega-3 level.
Right, exactly. It's very easy to do, and it's a very important marker. It's not just knowing what your EPA and DHA level is, and we express it as a percent. So the numbers you would get on the test would be something between, say, 2% and 10%. And what that means is it's a percent of the fatty acids that are in a red blood cell membrane. So we're really measuring a cell membrane level of omega-3, the red cell. And it's a percent of the fatty acids in the cell membrane that are EPA and DHA. So that'll range from, depending on how much omega-3 you eat, between 2% and 10, 12, 15% at some time. So that's the number comes as a percent. And it's very much like hemoglobin A1C test for a diabetic. That's the analogy I use a lot because that test also measures the glucose status in red blood cells and hemoglobin. And it's a very stable marker. This doesn't have the ups and downs, the spikes of plasma glucose. And similarly, the omega-3 index, which is a red cell measure, doesn't have the ups and downs of plasma omega-3. So it's a much more stable long-term marker of omega-3 status.
That's good to know. Tell us, why is it important to have a normal omega-3 level?
Well, I'll get picky with you on the word normal.
Okay.
I'm sure you know what I mean.
Yep.
Nobody wants to be normal or have a normal body weight in America. That's terrible. The average level of omega-3 in, say, North America or maybe Australia is in the neighborhood of 4 to 5%. Another population we like to compare to is the Japanese, where they have much, much less heart disease and much greater longevity. They live longer than we do. Their omega-3 index on average is around 9 or 10%, twice as high. And it's simply because they eat from, maybe from -9 months on from conception, they're exposed to a higher omega-3 level from all the fish. The American or the Australian levels of the omega-3 index indicate a low level that's associated with higher risk for cardiovascular disease. So we consider the omega-3 index not just a marker of how much omega-3 you got, but it's also, just like cholesterol, in a way, a risk factor. It's something that indicates what a level of risk for a disease, and it's something that you can do something about. You can fix it. And you can fix it, unlike cholesterol, you really can fix it completely with diet or maybe some nutritional supplements. So it's important to know, not just to say, well, gee whiz, isn't that nice? But if it's low, it indicates increased risk for future adverse events and you can fix it. You can change it, and that will reduce your risk. So that's important.
Yes, I agree with you. And it looks like Americans and Australians can really learn from the Japanese.
Yes, at least in that category for sure.
Yes, absolutely. It looks like we have to eat more fish.
Well, right. That opens up a whole other kettle of fish, as they say, which is, where are you going to get all these fish? If every person in the world was to eat what's recommended, we haven't got enough fish, either from wild caught or aquaculture at this point, to do it. So we've got to find new sources of the omega-3s, and there's a lot of research in that, maybe plant sources or algae sources, things like that.
Yes, that's true. So, Bill, can you tell the audience what advice can you give them in order to increase their omega-3 levels?
Yeah, that's a good question. And the simple answer is eat more what we'll call oily or fatty fish. And that doesn't mean fried fish, by the way.
Okay.
Not that kind of oil. Like salmon is a classically very good source of omega-3. Then you get into mackerel, herring, sardines, albacore tuna is a good source of omega-3. Typically, what we think of fish that you would bake or broil, not the ones you would fry. Those are the kinds of fish that have the most omega-3. I should mention that there is a plant omega-3 that's typically provided from flaxseed oil, flaxseed or chia seed oil, called alpha-linolenic acid, ALA, and it is strictly chemically speaking, it's an omega-3, but it's a shorter chain, a very kind of a poor second cousin to the EPA and DHA that are in fish oils, which are also in the omega-3 family. You really eating the plant omega-3, the plant oils that have ALA, does not raise your omega-3 index because those fatty acids are not converted well in the body to EPA and DHA. And those are all, EPA and DHA is all that counts when you talk about the omega-3 index. So the best sources are not plant oils, not flaxseed oil, but it's going to be fish oil, krill oil, algal oils, and eating, seafood.
Excellent advice, Bill. Now, before we go, what is your main takeaway message to all of our listeners out there? What would you like to tell them?
Well, I'd like to tell them how they can get the omega-3 test done on either themselves or on their patients, and that would be simply by going to our website, which is www.Omegaquant. That's omega and then the word quant, all one word, Quant, Omegaquant.com. And the test can be ordered there. We'll send you a dried blood spot collection kit and an envelope to send it back, and then we return the results to you in a PDF form within 5 days or so of receiving the sample in the lab. The test currently in U.S. dollars is $55. It includes everything, shipping and analysis. And so we have also opened a laboratory in Australia just last month. So we're at this point going to be processing samples from this part of the world here in Brisbane, which will be a faster turnaround. So that would be my most important take home, is to order the test on your patients, find out what their omega-3 status is, and if it's too low, fix it.
Excellent message. Thank you so much, Bill, for coming on the show. I really appreciate it.
You bet, Tabitha. Appreciated it.
And that was Dr. Bill Harris. We've just been talking about the new self-administered omega-3 test called Omegaquant and the importance of omega-3 to our health. If you like this interview, transcripts and archives are available at www.hpr.fm. We're on all social media platforms, so don't forget to follow, like, and subscribe. Show us your love by subscribing to our YouTube channel. We're also available for download on SoundCloud and iTunes. I'm Tabetha Moreto, and you're listening to Health Professional Radio.